maximum Social Security benefit for 2025, and how can we make sure you're getting closest to that amount as possible. My name is Ed Weir. I'm a former manager of the Social Security Administration. I've helped millions of people out throughout the country make sure they're getting everything they're entitled to, from Social Security, retirement, disability, survivor benefits, Medicare, Medicaid. So this is also a live Q&A. I'm going to talk about the maximum for Social Security, disability, Medicare, all the rest of it. Shouldn't take too long, about probably about 5 or 10 minutes. And then I'm going to open it up for questions. Like we already got a bunch of questions here. With Social Security, there's exceptions, the exceptions, the exceptions. So let's make sure your particular check is correct. You're doing the right thing when you make a decision. Social Security is not forgiving. If you make the wrong decision at the wrong time, you might have to pay for it for the rest of your life. So let's talk about all of those. All right. So in terms of the maximum, they just came out with a new COLA and everything. Not very exciting in terms of the COLA, 2.5% for next year. And that will reflect effective January. If you're receiving SSI, the welfare-based benefit supplemental security income, it comes December 31st. But for everybody else, if you're on retirement benefits, spouse benefits, survivor benefits, it starts January. That's 100% automatic. You don't have to do anything. The COLA is automatically calculated for all 70 million people, Americans, at the same time. So full retirement age, it's gone up a little bit this year. The full retirement age, so basically, if you paid the max for 35 years, that's how Social Security determines how much your benefits are going to be when you retire, and all that is your high 35 years of earnings. Even after you start collecting Social Security benefits, if that's one of your high 35 years, then Social Security recalculates and increases your benefits. That's automatic. Last year, the maximum, if you waited till your full retirement age, was $3,822. This year, it's gone up a little bit to $4,018. That is the max you can receive. If you wait until 70 years old and get those delayed retirement credits, this year, 2024, it was $4,873. According to the Social Security website, it's going to be $5,108. And what am I talking about? The max is, not everybody pays all of their money into FICA. I'm sure y'all that watching this, unless you're part of the, making millions of dollars. This year, the max you can pay into FICA for Social Security is $168,600. Next year, it's $176,100. So if you paid the maximum for 35 years, this is how much your benefit would be, $4,018. And after that amount, $168,600, you don't pay FICA Social Security more. The people that make over that still pay the Medicare, but they don't pay Social Security. That's one of the plans out there to address the shortfall of Social Security in the future, is to have everybody pay all of their income into Social Security, like the rest of us, regular people out there that don't make, millions of dollars. All right. So in terms of all the rest of it, so that's if you're receiving retirement benefits. What about spouse benefits? Spouse benefits are 50%. That is living spouse, divorced spouse. One of the things that changed in 2016 is that you cannot pick and choose if your spouse is still alive and kicking. So basically, you have to file for benefits on your own record, and then you file for benefits on a spouse record, current spouse or divorced spouse, if you were married to someone for at least 10 years. And you file for yours, and the spouse's benefit has to be twice your amount. And if you wait until your full retirement age, you get 50% of that amount. Surviving spouses, if you wait until your full retirement age and your deceased spouse didn't take their benefits early, then you can get 100% of that person's full benefit amount. So if the full benefit amount is $4,018, you get $4,018. If their full benefit amount, they waited till their full retirement age, because surviving spouses can get those delayed retirement credits, then your benefit amount would be $5,108 next year. What about disability? Disability is basically calculated the same way. If you file for benefits, disability, and your benefits start at 65 or let's say 55 years old, and you're high 35, you maxed out, then your disability benefits would be next year the $4,018. You don't get the delayed retirement credits at that time because there's no disability after your full retirement age. If you're receiving disability, it automatically stops at your full retirement age. It's just converted to retirement benefits. The check and everything stays the same. The amount stays the same. A little bit different, but my mission in semi-retirement here is to help y'all get everything you're entitled to from Social Security, and that includes Medicare. So one of the things about Medicare is don't waste your money on Medicare. If you're currently receiving health insurance from work, yours or your spouse's, you do not need to sign up for Part B. A lot of people, when I ran the third busiest Social Security office in the country, people used to come in all the time, sign up for Part B, pay that $174.70, and for no reason whatsoever, they already had health insurance from work. They were happy with it. Their employer had 20 or more employees. So don't waste your money on Part B if you don't need it. If you do need it, because you don't have health insurance from work, yours or your spouse's, then if you don't sign up for Part B when you're supposed to, then you're going to get penalized for the rest of your life. And that's 10% for every 12 months you did not sign up. Same type of thing for Part D, the prescription drug plan. It's not 10%, it's actually 1% for every month you did not sign up for Part D when you were supposed to, 65, or if you get disability after 24 months of being on disability. Medicare does not cover everything. There's a lot of gaps on Medicare. The big one is Part B. There's a gap in Part B. There's a 20% gap, and people cover that. If you don't have a few $1,000,000 in your bank account to cover all the gaps of Part A and Part B, people either get a Medicare supplement plan. Those are the ones with the letters N and G and F. You get one of those, or you get a Medicare Advantage plan. This is the big season right now from October 15th to December 7th. This is the most chaotic Medicare season since probably day one. A lot of people are being canceled. There's close to 2 million people that received a cancellation letter that their plan, their Medicare Advantage plan or their Part D plan has been canceled. And unfortunately, it looks like a lot of people didn't open the mail, or they didn't realize they're being canceled. And there's going to be a lot of people, I guarantee you, in January, they're going to go to the doctor, and the doctor's going to say, okay, now you owe us, $3,000. And they're like, wait, what about my Medicare plan? Well, you were canceled a few months ago. So if you know anybody, make sure you reach out to them. I partnered with an organization chapter, and if you need help, reach out to them, and they can review your plan 100% for free to make sure you haven't been canceled or downgraded. A lot of people, these insurance companies, if they're not making enough money on you, they just cancel you to right out. 2 million people, close to 2 million people just been canceled straight out because the company says, we're never going to make money on the people that live in these areas. Or they do kind of a soft cancellation, which I call, is basically they say, okay, well, we can't make money on these people, but these people are here, and this group of people live in this part of the country. We're probably not making a whole bunch of money. What we'll do is we'll downgrade their plan so much, so we will make a bunch of money on them. So if you don't look at your particular plan and review it, then you are going to have some big surprises. And if you're making the max Social Security, you won't make the max Social Security because you'll be spending all that money on health care next year. So please reach out to everybody you know and make sure they review their plans for 2025. It's going to be a crazy, crazy year. And unfortunately, a lot of surprises in January. Okay. All right. Let's go ahead and get into your questions and answer. If you have any questions on all things Social Security, retirement, survivor benefits, disability, Medicare, all the rest of it, just go ahead and type them in there, and let's see what we got. I'll answer questions for about the next 15 minutes. Been divorced 20 years, never remarried. Ex-husband remarried right away and been married 20 years. We had been married for 19, 20 years. I collect my own Social Security. Can I still collect on his earnings still? Yes. You were married. You're currently receiving benefits on your own record. You were married at least 10 years. It doesn't matter whether he's been remarried, as long as he is at least 62 years old. A lot of people miss that. They think that They have to wait for their ex-spouse to file for benefits. That's not correct. It's called independently entitled divorce spouse benefits. You can file for spouse benefits, divorce spouse benefits on that person's record as long as they're 62. It does not matter if they have filed for benefits or not. Too many people are missing those benefits. And unfortunately, people go to Social Security Administration, and Social Security Administration are telling them the same thing. Your ex has to be filing, your ex has to be receiving benefits. That's 100% incorrect. Those are just people at the front window, generalists, that need to be educated more, unfortunately. If you talk to an actual claims specialist and get an appointment, then they'll sign you up. And then you tell them, hey, by the way, that person at the front window told me something different. You need to train that person. Yeah. I am currently receiving widow's benefits. I have received inheritance funds from the sale of my parents' home. Concerned this will put me over the annual amount. Nope, not an issue whatsoever. It's not earned income. So I assume widow's benefits is actually widow's benefits. It's not SSI, which is the welfare-based program. If it's SSI, the welfare-based program, the keyword welfare-based, it's income and resource limited, and yes, it will affect. But in terms of widow's benefits, straight survivor benefits, nope, no effect whatsoever. Do with that money whatever you want. It's all yours. Pat, I am on SSI and I decide to get my X benefits be affected. If you're on SSI, the welfare-based benefits, then you pretty much have to. If you have any other money out there available because you're on the welfare-based system, SSI, then they obligate you. It's like you're receiving welfare, and you get, like, the person has an inheritance, and I don't want to touch the inheritance because I'm receiving SSI and I don't want that to affect. Well, no, you have to take it. So if you have any other benefits out there, ex-spouse benefits, yes, you have to take it if you're receiving SSI. Max, thanks for your service, advice, and help you give us. You're welcome. Thank you very much for taking the time to write that. I appreciate that. Hello, I am the one that asked about being 60 on disability and have been just awarded VA. Okay, via disability. Will getting DIC interfere with Social Security? No, VA benefits do not affect your Social Security benefits at all. Not at all. I had, being an old Marine Corps sergeant myself, I had a bunch of vets working in my office, and they were working and receiving VA disability, because VA disability is different than Social Security disability. You get the 10%, 20%, 30%, whatever the case may be. With Social Security, you're either disabled or you're not. And so I had a bunch of disabled vets working in my office, and they were receiving 10, 20, 30, 40%. Social Security wouldn't consider them disabled because they're working. But one doesn't affect the other one at all. No problems at all there. Susie, hello. I am currently receiving widow's benefits. I have received, okay, I already answered that one. Asked twice. Let's see here. Let me get to different people. How long does it take to get a mental evaluation scheduled? I had a hearing, but the judge stopped it and said that I need to have a mental evaluation done. Yeah, that really doesn't happen a whole heck of a lot at the administrative law judge stage. Administrative law judge, basically, it sounds like you filed for disability benefits and denied at the initial stage, and then did the reconsideration and denied there, and then you waited a year or 2 years to do your hearing. And there's if that's your disability, I'm wondering why they did that. Yeah, that's unusual. It happens, but it's very unusual. I wonder if they're doing the evaluation to see if you can be your own representative payee. That's usually what that is to see whether they've made the decision. Sounds like yes in this case, and they're just saying, okay, let's see if this person can take care of their own funds. If they can't take care of their own funds, then we need to find a representative payee to take care of those funds. And so I guess that would be a good thing. So that means you've been approved if that's the case. But in terms of the disability, yeah, it's unusual that they would, ask for more medical records like that. 99% of the time, it's because you've been approved and they're seeing if you can take care of your own funds. And one of the things about representative payee that a lot of people don't know is if there's nobody that will be your representative payee, then they can't hold your benefits. we used to have Margaret. She used to come into our office and she needed a represented payee because she could not take care of her own funds. She used to come into our office and steal our toilet paper. And it was great. Anyway, um, but we contacted her kids to see if they wanted to be a represented payee. They were like, no, we don't know. We've given up on that. And nobody wanted to be a representative payee. So we had to give her check. And then every couple of months she would come in and say it was stolen by aliens or something like that. Anyway, so yeah, the Social Security, if there's nobody that can be your represented payee, then they have to release the funds to you. They are your funds. So just kind of FYI. Hi, Margaret, if you're out there. If you're in arrears on taxes, will that affect your payment? What about student loans? Yeah, if the government, the long arm of the law, they can, yeah, they can come after your Social Security check. This P.S. This income was used to pay back loans accrued since spouse to they. Oh, okay. So you're talking about the inheritance thing. Yeah, get widow's benefits doesn't affect anything. Can you get SSDI and VA at the same time? Yep, absolutely. Like I said, it doesn't affect one, does not affect the other one at all. Let's see if we have any other questions here in this other form. I made a lot more than my late husband. Will I be able to get any widow's benefits when I'm 62? Well, widow's benefits you can actually get at 60 years old. And for widow's benefits, this is one of the exceptions, is that you do not have to file for benefits on your own record. So here's a strategy. If you made a lot more than your late husband, then your benefit amount is probably higher. But if you wait until your full retirement age or 70 years old, and your benefit will continue to increase every month until you hit 70 years old. So maybe you want to take the lower amount, the surviving spouse amount now, to get a check coming in, and then wait on yours until yours increases to an amount that, you just jump over from survivor to retirement claims to your retirement. Or you can do the reverse, get retirement first and then switch over to survivors later. So that's one of the benefit programs. You do not have to file for one first before the other. If the person is alive, you have to file for your retirement benefits on your own record first, and then the spouse on top of that. One offsets the other. My daughter was on SSDI, but has been denied for SSI because, people can get SSI and SSDI. SSI, again, is a welfare-based program. The max you can get is $943. So if you're SSDI, the Social Security Disability Insurance is, let's say, $500, and you have no other income or resources, you can continue to get that $500 plus an extra $443 from SSI. But it sounds as though if your SSI was denied, probably because you got other resources, or your SSDI is too much. Tracy, I will be 63 early 2025. If I decided not to work and not take my Social Security until I turn 70, does the amount shown on my current statement remain the same, or will it be reduced? It would never be reduced if you continue waiting. No, it'll be increased. And on your statement online, they're pretty accurate, but they don't know future COLAs and how much you work. Every year you work and pay into Social Security, you're if that's one of your high 35 years, the benefit will go up. And if I decided to, but yeah, okay, all right. So you stop working. Okay, I see. Yes, in that case, maybe. So if this goes for any age, let's say you're 60 years old, and you look at your benefit amount online, and it says $3,000. And then you immediately stop working, then that's going to go down, because what happens is the computer system, your estimate is based on it kind of future projected earnings. So it basically says, hey, you've been making $80,000 the last few years. We're going to project that you're going to continue making $80,000 until your full retirement age. So yes, in that case, your benefit is going to be less than what it shows on there, because you're basically going to stop working and stop putting into FICA at that particular time. But you can go in there and kind of manually figure it out. Just go to the bottom of that page there, and it has kind of a manual calculation, and you take out the, their estimates, projected estimates, and just put zeros, and that'll give you your correct amount. So I am divorced. I am moving to Brazil and getting married. My ex is still alive. What is best for me? Bon voyage. Yeah, I mean, if you're 62, file for benefits on your own record and see if there's any money, if your ex's benefit amount is twice theirs. If so, you can collect up to 50% if you're full retirement age. I just to check to see how much my husband can receive off my record. I have to start my benefit first. Will the amount I saw be added to what he already receives? Yes, you have to file for benefits on your own record first. And if your benefit amount, your full benefit amount at your full retirement age, if it's twice his full benefit amount at full retirement age, then basically he gets the difference between the two, up to 50%. If he's his full retirement age, then he gets 50% of your full benefit amount. So let's say if your full benefit amount is $2,000, so 50% is $1,000. So he can get up to $1,000. If he's already getting $800 from his own, he'll continue to get his $800 plus another $200 from you. So let's see. I owe Social Security for overpay. Will I still get Medicare? I'm 70 in January. Yes, absolutely. Any type of overpayment or anything like that will not affect Medicare. But you're 70 in January. Hopefully you're receiving your benefits, or if you're not receiving your benefits, then you have to get them at 70, because it's not going to increase anymore once you hit, after you hit 70 there. But yeah, it won't affect Medicare. Hopefully you are receiving Medicare, because if you are not receiving Medicare, then you pretty much 5 years late if you don't have health insurance for work, and then you're going to be paying a 50% penalty for the rest of your life. So yeah. Did I understand yesterday if you were remarried by age 60 and my first husband passed away, I could still draw survivor benefits from him if I'm still married to someone else? Yeah, if you get remarried after 60, yes. They changed that law in the 90s or so. Yeah, that you can remarry and continue survivor benefits if you remarry after 60 years old. Carl, I am 66 years old, still working. My question is it possible to get spousal benefits from my wife who is retired and collecting Social Security? Yeah, it depends on how much you're working. There's a limit, but you're 66 years old. So I'm not sure when your full retirement age, what year. So it's already close, it's October-ish now. So if you're your full retirement age, there's a different limit. The year you turn your full retirement age, you're allowed to make close to, well, next year it's $60,000 or so. What's the exact number for next year? $62,160. Those are the months before you hit your full retirement age. So you can collect benefits and continue to work. This year it's the $22,320. But yes, you have to file for benefits on your own record first, and then file for those spouse benefits. Donna, I am getting health insurance via my work. My FRA is 66 in 10 months, and I was told we do not need to file for Part A at 65 as we already have insurance. Part A is different. You don't have to file for Part B, but if you start your benefits, then at 65, they sign you up for Part A automatically. If you're 66, 67, whatever, they start your Part A automatically if you start your benefits. But Part B, because Part A that covers the hospitals, and that's zero premium, so there's no premium, so it shouldn't be an issue. But Part B, you do not have to sign up for if you have health insurance from current work. And then once you stop working at 70, 75, 80 years old, then you go ahead and sign up for Part B at that time, and there's no penalty whatsoever. I'm a widow and still work. I'm turned 60 in May. Will I be able to draw from my husband's Social Security? It depends how much you're earning right now. You can collect survivor benefits starting at 60 years old, but if you're working, making over the full, over the allowed limit, the $22,320, then Social Security is going to hold back $1 for every $2 you go over. I asked when I first filed for my Social Security, they told me I can't draw. Okay, what is that? A second question? Let me see. Was it? I understand yesterday, if you remarried by 60, first husband passed away, you could still draw survivor benefits from him. And then your second question, I asked when I filed for my Social Security, they told me I can't draw. Because you were married at the time, you weren't, you're married before 60 and you were still married. Or his benefit amount wasn't more than yours, or you weren't married for 10 years. Yeah, so I'm not sure. How does Social Security calculate benefits if I only worked less than 35 years, i.e. 19 years and paid for FICA? Yeah, then they just basically divide the thing by 35. So however many years you worked, they take your annual indexed monthly earnings. They take all your earnings for your high 35 years, or your case, your high 19 years. They index it based on a wage index, and they come up with your average. But in your case, they do that and they divide it by 35. It doesn't matter if you have 19 or 10 or 20. They still divide it by 35 years average to get the average. So you've got a bunch of zeros in there. So that's going to bring down your benefit amount. What is the max you can make on Social Security in 2025 for people not at, you probably mean full retirement age? Next year, it is $23,400. How does a person who is disabled stay on disability at retirement age? Don't do anything. You stay disabled, I guess. But once you hit your full retirement age, they automatically switch you. Everybody that is receiving disability, once they hit their full retirement age, their benefits are just automatically converted to regular retirement benefits. And most people don't even recognize the switch because your check stays the same and everything. So nothing really changes, except for they stop taking your money out of the disability trust fund and start taking out of the retirement trust fund. And you're no longer limited because you're receiving just regular old retirement benefits, and you're after your full retirement age. You can work as much as you want. You don't have to worry about Social Security, breathing down your neck. You don't have those CDRs, the continuing disability reviews, anymore. You are completely free. You're no longer receiving retirement benefits, and you can do whatever you want. Steve, my wife wants to know if she can collect from her ex-husband's Social Security benefits as well as mine. No, because sounds like y'all are still married because you said my wife. So nope, she cannot get both. If she divorces you, hopefully she's not hearing this, and her ex's benefit is more, then she can switch on to the higher benefit amount. So hopefully you're nice enough to her to where you entice her not to take the higher benefit amount by divorcing you. So there's that. I got a check from Social Security for $9 the other day, got letter to recalculated benefit based on tax return, and paid $1 additional per month in benefits. Yep. Okay. So yes, that's normal. Basically, yeah, if you work and continue paying to the Social Security, then Social Security automatically recalculates the benefits. So you file your taxes for last year, you tell the IRS tells Social Security looks at the number and says, hey, is this one of the high 35 years of earnings? If it is, they kick out the low one, stick in the new one, recalculate, and then it's, yeah, and they take it retroactive all the way to January. So you got a whole $9. So as they say in the movie Trading Places, now you can go to the movie and by yourself, right? If on SSDI and turn 67, can that individual delay retirement until 70, or is it forced? Yes, that is a very unusual thing that not a lot of people know about, and not a lot of people would do it. But my job here is to get the information out there, and whatever you do with it is completely up to you. But this is called voluntary delayed retirement credits. Because your disability has switched to retirement benefits and now you're your full retirement age, you can actually stop your benefits, voluntarily stop them to get those delayed retirement credits and the other 8% per year up until you hit 70 years old. So yes, but if you do that, you're going to get a little pushback from the local Social Security office because not a lot of people know about that. and you just say, I want voluntary delayed retirement credits. And then you say, go look it up. Where actually, if you're interested, I can put that in the bot. I can put the reference in there, and that way you go in there with you go in there. I'm not gonna say armed. You're going to go in there with information, the actual policy. Let's see. I divorced after 14 years of marriage. I moved to Canada. My ex has passed away, and I've retired now. Would I still be able to apply for Social Security under spousal benefits? Absolutely. You were married for 14 years. Yep. If as long as that benefit amount is more than yours, or if you haven't started, as long as you're 60 years old, I would definitely file. Work and all that kind of stuff comes into play. But based on that question, yes, absolutely. Was Medicare or Social Security hacked by cyber criminals? I got a letter Saturday that leads me to believe this is a cyber guy who also releases info about this. Um, Neither of them that I know of. I know there's a bunch of companies out there that you never really hear it from about Social Security. And in my office, you know, it's Social Security is super obsessive about protecting people's information like that. And but yeah, you don't really hear it, knock on wood there, from Social Security losing stuff. It's usually some department store, or that one in Florida that you used to, some company that put together stuff. There are companies and hospitals that work with Medicare, that take Medicare, that have lost stuff. But yeah, I haven't heard really anything about Social Security itself, or CMS, the Center for Medicare and Medicaid Services, losing stuff. It's usually those private companies that are losing stuff left and right. So, could I collect my ex's VA benefits? He spent 13 years in the service. We were married. Yeah, you'd have to. Even though I'm a vet, I never worked for the VA, so I can't really speak to that. Like all those other people on social media who didn't work for Social Security, didn't take hundreds of thousands of claims, and didn't go through years and decades of training to read the policy, 20,000 pages of policy manual, stop giving Social Security advice, please. Too many people are receiving incorrect advice on the social media, YouTube and TikTok and all that kind of stuff, and they're losing benefits. So please, if stick to what you know. If I'm on SSDI and receive widow's benefits, start working and lose my disability, will I lose my widow's benefits? It depends on how much you make. Again, the annual earnings limit, if you go over that, then yes, your benefits are going to be withheld $1 for every $2 you go over. So, but Kimberly is a perfect example. A lot of people don't recognize that if you're receiving disability benefits, you can also receive survivor benefits, or spouse benefits, or divorce spouse benefits if there's more money there. Um, you know, Over 50%. All those things I talked about. Because a lot of people are receiving disability, and they say, well, I can also receive divorce spouse benefits or surviving spouse benefits, but if I receive those, my disability will stop. And because my disability will stop, my Medicare will stop. That is 100% incorrect. You can continue to get your disability, continue to get your Medicare, and get spouse benefits or survivor benefits and all the rest of it. So just like Kimberly, perfect example. She is receiving SSDI and widow's benefits, and probably Medicare too, right? So, husband is on SSDI and the wife receiving $400 from her work pension. Is she qualified for spousal benefits from husband? Yeah, the work pension, no relevance whatsoever, zero relevance. Unless, see, this is why there's exceptions. This is probably not the case in this particular, because if that pension comes from non-covered employment, that is, you worked for a state, city, local government that does not pay into Social Security, this is called a windfall elimination provision, or in terms of the spouse, it's a government pension offset. But if that $400 is just from some type of private company or a state that does pay into Social Security, no relevance whatsoever. Yes. So it doesn't matter if she doesn't have any credits, no problem. But if she doesn't have any credits herself, that means maybe she has a pension. So maybe that means she did work for a governmental entity that did not pay into Social Security. Sorry, I'm kind of reading between the lines here. That's what happens when you've done this a million times. So She might be government pension offset. So 2/3 of that pension might offset what she would receive from her husband. But again, I'm just kind of reading between the lines there. I filed April 4th of this year, and on step 3, will it be much longer? It depends what you filed for. If it's for disability, then yeah, it could be months. For retirement, yeah, you should have already received your benefits. That's not right. My sister wants to know how much she would get from both her ex-husband's Social Security. She was married. It really depends on how much they made. I was married for 9 years, but it took 5 years for a divorce. My question is, would it be able to qualify to being married? We were married for a total of 14 years. Yeah, it doesn't matter. As long as your paperwork says, your marriage certificate says, date this, and your divorce decree says date that. Doesn't matter how long it took. As long as that is 10 years, then you're good. So it looks like you were married 14 years, so that's good. So that's the only thing they do is they look on. And here's another thing that a lot of people are missing money out there. So please share and subscribe and like and all that kind of good stuff. So more people need to hear this information. There's a lot of people out there that are eligible to receive more benefits like survivor benefits or divorce spouse benefits, but in their divorce, the ex-spouse or the tricky lawyer puts something in there about you will never get my Social Security benefits, and that is 100% garbage, BS. Social Security doesn't care. I've taken hundreds of thousands of divorce spouse benefits, and I say, I need your marriage certificate, I need a divorce decree. And I get the marriage certificate, I look at the names, I look at when they were married, I get the divorce decree, I look at the names, when they were divorced, don't look at anything else. I just look at those 3 pieces of information. That's it, period. Don't look at anything else. So, well, sometimes I look, divorces in the 1970s. I always like to see who got the 1970 Chevelle and stuff like that, how much it was worth and stuff. $1,200. Wow. Anyway, my husband, 67, had a stroke. Can he still receive disability? He retired at 63. Yeah, if he's 67, then he's basically his full retirement age. So probably not, unless he had the stroke a couple of years ago. Then you file and maybe they can backdate it. But yeah, so because he's his full retirement age, nobody in the country gets disability after their full retirement age. Please like and share the video. Yes, it helps more people find this information. Yes. YouTube needs to change their algorithm. A like with what I would consider important information like this should be worth 1,000 times more than a like on a cat video. But there has to be some type of societal impact for likes on YouTube and TikTok and all that kind of stuff. But there's not. So what are you going to do? I have 28,000 in mutual funds. Will I get penalized for getting it now? I have Social Security disability. Nope. As long as you are receiving Social Security disability insurance, SSDI. Yep, mutual funds, 0 issue. And if you're getting SSI, well, you probably wouldn't get SSI at the beginning because if you told them you had 28,000, they deny you for the welfare benefit. So you're probably just getting regular SSDI, and nope, no issue whatsoever. The total I get is $915 after my insurance is taken out. Okay. Let's see what other kind of questions we got here on these other platforms. Let's see here. With everybody that's trying to control the weight. Okay, let's see here. Bunch of not many questions on this other thing. Let's see here. I've applied for SSDI after my DC said, I thought this means disabled adult child, but I guess your doctor of chiropractic said I couldn't return to work. At the medical review, how long does it take? I had not been able to work as of June 2024. Yeah, if you applied for SSDI, then unfortunately, when I took, the hundreds of thousands of disability claims I took when I was working, I used to tell people you get your answer in 3 to 6 months, but now Social Security is way, way, way understaffed. So they're telling people now 6 to 9 months if you're lucky. There is if you have a serious disability, there's a kind of a compassionate allowance. There's an algorithm that Social Security uses. I've had cases that were approved the same day. I have cases that were just people have a terrible accident or in their final stages of cancer and stuff like that and file for it, and 9 o'clock in the morning, and their cases are approved by the end of the day. But for other things, it's, yeah, unfortunately, it takes way, way, way too long. And how do you solve that? You reach out to your politicians and say, okay, what are you doing to improve the customer service at your local office, in your local office, in your jurisdiction? So we need to hold these people accountable. Okay, let me see. I filed April 4th for SSDI announced. Okay, yeah, you already answered that one. If on SSDI, can you delay retirement till 70? Okay, yep. I already answered that one. That's a voluntary delayed retirement credits. I received SSDI. My spouse has passed away and was collecting SSDI at 36. Can I wait till I'm 62 to receive 100% of his check instead of the 71.5? No. You'll have to wait until your full retirement age to receive 100%. So you're thinking probably of the widow's limb, the rib limb, the widow's cap type thing, but that's not, doesn't apply because your spouse was not receiving retirement benefits. They were receiving disability, and that doesn't trigger the widow's limb. So you would have to wait till your full retirement age to get the 100%. But what I would do is I would check out your options, because maybe you're, did switch to whatever. So I would call Social Security. Can I, as soon as 60, and check out and find out what the number is. Find out how much your actual dollar amount is if you start at 60 years old, and then say, okay, what if I wait for a year or 2 years? How much is it going to be if I wait for a year or 2 years? And they'll give you the number. And then if it's increases as much as you thought it would be, then wait. If not, and you need the money, get that money. It's yours. I'm 58, spouse is 52, 2 minor children. My PIA is 2,000 and max family benefits is 3K. Will each child receive 1,050% of PIA or only 500 half? So yeah, so you're receiving $2,000. Your full benefit, your family benefit is 3,000. So 3,000 minus your 2,000, so that's $1,000 left over. So each child will receive $500. Assuming my spouse continues to work and does not claim benefits, later when my spouse retires and starts his retirement benefits, can our children switch to him since he has a higher PIA? Yes, absolutely. Good thing for noticing that. Absolutely. If they're still obviously under the age of 18 or still in high school or became disabled before the age of 22. Yes, always switch to the higher benefit amount. Anyone here know about the word origin in a Social Security web address, or where I can? Yeah, not sure what that means. How much is Part A Medicare? 0 for most people. If you paid into Social Security for at least 10 years, then it's 0. Donna, I'm not going to retire until my full retirement age. I just want to make sure that I'm not going to get in trouble for not filing for Part A now. Nope, you're good. I just turned 65. Nope. You can file. Some people do file for Part A and just say, hey, I just want Part A. I don't want you to turn on my benefits. I just want Part A. Part B, you can deny, refuse, because you're currently working and have health insurance from work and your employer has 20 or more employees, you or your spouse. But one thing on Part A, if you go ahead and sign up for Part A, if you're contributing to a HSA, a health savings account, then you have to stop that 6 months before, or the IRS is going to send you a nasty gram. But why do people sign up for Part A when they already have health insurance for work? One of the reasons is it's 0 premium and you got a little bit extra coverage there, particularly because Part A covers your hospital. So, and this year, the deductible, if you go into the hospital, is $1,632. If your insurance from work, check your insurance from work. If your deductible from work is $3,000, if you go to the hospital, then I would get Part A, because you're going to save yourself, what, $1,400 or so. So, bless you. Ah, thank you. Divorced 20 years ago, now 67, just married 6 months ago with a wonderful man, 75. Do I need to wait 12 months to claim his Social Security? There is exception in there. If you are currently, usually have to wait a year unless you are currently receiving benefits. He's receiving benefits, then you can switch automatically. You don't have to wait a year. So I would contact Social Security and don't sit around twiddle your thumbs for a year waiting, because again, if you're both receiving benefits on another record or something like that, you can. There is an exception for the 1 year rule. So I would definitely reach out. I asked a question yesterday about the grid rule, about amending it to the case. I called the Social Security and the employees didn't have a clue what I was talking about. Do they? No, yeah, the Social Security employees don't do disability. They take the claim and then they send it up to disability determination service. Yeah, I remember the guy's name, Jonathan Ginsburg. He has a bunch of videos on the grid rule. So just reach out to them. Yeah, Social Security employees. That's yeah. They will not know what you're talking about. They don't do the medical portion. That's done by the DDS, Disability Determination Service, the state agency in your state. I will be 65 come February 2025 and will be receiving only, tell Jonathan Ginsburg I said hi. He's an excellent guy. He's about the only disability guy that's doing YouTube that I really trust. So there's that. Nicest guy. I will be 65 come February 2025 and will be receiving only $650. If I reach full retirement age, will I get the amount allotted that year? So yeah, if you wait until your full retirement age, that benefit will definitely go up. But if you're only getting $650, there's a lot of other programs out there for you, unless you're receiving $650 because again, you work for a government entity that did not pay into Social Security. But if all you're receiving is $650 because of that's based on your work, then please check out my video I did on. I got to figure out how to do this. I suck at YouTube. How to live on Social Security alone. So I go over about 50 different programs that might make your life easier. Anybody. So watch that video. It's based on a 4-part series I did. That's a longer video with a terrible, boring introduction, but there it is. So I told you I suck at YouTube. I'm getting better, but anyway. Oh, Connie, thank you very much. $10. Oh, I appreciate it. Thank you very much. That'll give me my coffee high for the day. Appreciate it. I always say a beer or coffee, but even in the Marine Corps, I was known as one beer Weir. So $10 will get me for the week. I was married to him for 26 years. I remarried at 61, but was told I couldn't get death benefits. Can I get the reference? Can I get? I remarried at 61, but told I could not get death benefits. Death benefit, lump sum death benefits. Then yeah, that's. But yeah, this I don't have the reference available because that's pretty easy thing that people know about. Probably what happened is if you probably just called the 800 number or called your local office or went to your local office and someone at the front, which are generalists, they're not specialists, and they told you X, Y, or Z. That's not a decision by Social Security. I would file for those benefits, and if you did it 6 months ago and you were told incorrect information, I would tell them to make right their decision, their mistake, by giving you the 6 months retroactive pay. And I would file and say, okay, I appreciate your opinion that I'm not entitled, but I want an official decision. And an official decision is a letter. So they will take your claim, put it through the system, push the button, and if there's money, you'll get the check. If there's not, you will get a letter that says, this is why you were denied. And then you have an official decision. But I don't think you got an official decision. I mean, if there's some other reason why you were denied because of the benefit amount or something like that, because it wasn't as much as yours or whatever the case may be, that might be a different issue, but at least you'll get an official decision. I started my Social Security benefits. If I go back to work, how do I reset my benefits as if I never started? Is it better to pay back or collect credits? Will I collect credits for life? Not sure what the credit. I mean, if you're already entitled, you already got your 40 quarters of coverage, the 10 years, so that's not an issue. Yeah, if you go back to work, if you started your Social Security benefits within the last 12 months and you change your mind, you can withdraw your application. It has to be within 12 months. You withdraw your application and it's like it never happened. Because it never happened, you have to pay all that money back. And you can only do that one time the first 12 months. If it's after that 12 months, then yeah, all you do is call and you file a work report and say, hey, got a good job, got a raise, I'm going to make in, 60, 70, $80,000. And they'll start, withholding your benefits, $1 for every $2 you go over. And in terms of, maybe you're talking about, will you get credit for that? Yeah, and basically it is, once you hit your full retirement age, those benefits are automatically recalculated, and your monthly benefit amount is credited, I guess, for your unreduced. So if you, like, for instance, if you get your benefits 30 months early, you've been reduced for 30 months. And then if you, after 10 months, you don't get a check anymore because you're working, then once you hit your full retirement age, they will unreduce your benefits from 30 months to only 10 months, however many months you actually got. So that's automatic and you don't have to do anything. Told to collect survivor benefits now and to allow my deceased spouse benefits to continue to accrue until my full retirement age. Yeah, that's the same thing. Told to collect survivor benefits and allow my deceased spouse. Yeah. So now you're possibly told to collect survivor benefits now and let your benefit amount increase. Yes, that is true. But yeah, the way it's written there, that doesn't. Yeah, it's the same thing. So it doesn't make sense. But yeah, you can collect survivor benefits and let yours increase. Can you say what the income cap for next year is? Plan to file at full retirement age in August 2025, but still need to work part-time to pay off some income cap. Yeah, next year it's the $23,400. If you're looking before your full retirement age, the year you turn your full retirement, it's $62,160. Hello, Massachusetts. Continuing to work with insurance from work. Under 20 employees currently, frequently over 20 during the year. HR is reviewing our HC benefits. Do I need to file? Yeah, so if you have a company that kind of goes in and out and in and out, then you need to call the insurance company. Because basically what it is, it's all about the insurance company, whatever company you're dealing with. If you do not sign up for Part B, then, and if your employer has, under 20 employees, then basically you have to cover. If you didn't sign up for Part B, they're going to send those bills to the insurance company, and the insurance company is going to send it to you because you should have signed up for Part B. It's basically the insurance company trying to get out of paying money, which is kind of what the job of an insurance company is, I guess. So yeah, you need to reach out to them to find out whether they are considered 20 or more employees, and they do this weird calculation. And if they're good, then you're good. But if not, then yeah, you definitely need to sign up for Part B, and then you need to, and D, and then get, find a Medicare supplement or, Medicare Advantage plan or whatever the case may be. Oh, here we go. I just got approved for disability, but it looks like it's only going off of my records. Yeah, that's the only thing it will go off of. I was married over a decade, and I'm sure at this point he is the larger payment. How can I ask for that? Yeah, so disability is based on your record, unless he's deceased and you filing for disabled widows benefits, but that doesn't sound like the case. So you're approved for disability. Good. Now go get spouse benefits. You can start at those at 62 years old if your ex-spouse is still alive. 62 years old, but his benefit amount has to be over twice your benefit amount. So those are two different claims. When I reach my full retirement age and file for my SSI, I'm divorced. Can I get SSI? Is the welfare-based program. You can file for that at any time if you're disabled or if you're over 65. Greetings. What happens when Ready starts, but one can't own money? Yeah, student loans. Yeah, I mean, if they want to, depends who has the student loan. And if you have a debt to the government, they can come after pretty much anything, can't they? Except for SSI usually. I'm on, well, even if you have a debt to Social Security, they can. I'm on SSDI and have been on Medicare Advantage plan now, PPO, for the past 18 months. I am 61 and my disability is mental and not physical. Would I be able to get underwritten for a Medigap? It really, 61, yeah. It depends on your state. But when you turn 65, yes, guaranteed. When you turn 65, you can get a Medicare supplement plan, the N or the G or the F, whatever the case may be. Medigap plan, same thing. Medigap, Medicare supplement plan, same thing. They can't deny you. There's no pre-existing conditions or anything like that. They can't charge you more at 65, but at 61, it depends on your state. Probably not, because sounds like you would have gotten that before. So, but at the very least, I would definitely check to see if you're in the best Medicare Advantage plan for you next year, and your plan hasn't been canceled and all the rest of it. So reach out to my partners at Chapter, and they will help you out 100% free. I was on SSI, now I'm on SSDI. Why has my SSI stopped? Because your SSDI is probably more than $943 a month. I'm a widow and was married 46 years and received my late husband's Social Security. If I remarry, do I lose my first husband's Social Security? Not if you remarry after the age of 60 years old. What benefits could you collect on a deceased spouse and an adopted child? What age would I have to be? Asking for a friend. Yeah, all right, Vicky, thank you for asking for a friend. We try to be a good community here and help people out around us. For a deceased spouse, the child is an adopted child, so that's considered child. So the child can receive, as a deceased surviving child, 75% of the parent's full benefit amount. And a spouse, if the spouse is 60 years old, the spouse can receive 75%. Or if the child is under 16 years old, the spouse can receive what's called surviving child and care benefits if she's not working or not working very much under the annual earnings limit. Or if the child is disabled, can receive, when the child turns 18 or 19, receive disabled adult child benefits. So there's a lot of options. So tell your friend to reach out to Social Security and file for those benefits immediately, if not sooner, particularly for the adopted child if the child is under 18. All right, let's see here. If you retire before full retirement age, will you be able to get that amount when you reach that age? No. Once you're if you stop your checks, yes. Or you stop some of them, then it'll be closer. Yeah, I'm trying to avoid politics here. So, but I've done a few videos on it, and there's one that anyway, I won't get into politics. Depends on your age. Okay, let's see. If you're married, you should be able to keep your. Okay, thanks, Penelope, for jumping in there. How much time is allotted to your conference calls when scheduled through Calendly? I'm wanting to schedule a private consult. Thank you for all do. 30 minutes. Yep. Let's see here. This is my third stroke along with a seizure. I have my right side that is not functional. So thanks for the hope. I'm 61. Yeah, if you're having a disability, please apply for disability benefits. I started collecting ex-spousal benefits at the age receiving 62. My ex-spouse continues to work. Will my spousal benefits increase over the years? Yeah, based on COLA. And if your ex-spouse continues to work and pays into Social Security, then his primary insurance amount will increase. And that's how your benefits are calculated, based on his benefit amount. So, tell him to keep working, make more money so it increases your benefits. Absolutely. Do I need to get Medicare after 24 months on SSDI as a widow's benefit? Must I sign up if I turn 60, and would I have been eligible for widow's benefits as have ACA insurance as it's cheaper? Once you're eligible for Medicare, then unfortunately, you pretty much just lose your Medicare. You lose your ACA subsidies, and it's no longer going to be cheaper because you're eligible for Medicare. So once you're hit the 24 months, you have to sign up for Medicare, unless you have health insurance from work or spouse's work and stuff like that. But yeah, the ACA is cheaper because you're getting those advanced premium tax credits and the cost sharing and everything. But once you're eligible for Medicare, unfortunately, those go away. So yeah, just reach out to someone. They'll be able to help you out, walk you through that. If I don't retire at the age 65, I'm being forced to pay for the Medicare of if you don't retire. So now if you have health insurance from work, no, you do not have to sign up for Medicare. If what did I say that right? If you have health insurance from your spouses, then you do not have to sign up. You do not. Yeah, that's a people think, oh, at 65 it's mandatory. No, if you have health insurance for work and all that, then you don't have to sign up. All right, let me do. We're close to the hour here. Let's make this one or two last of the questions. I started receiving SSDI in 2014. My husband passed 2015. He was only 42. I am 58. What benefits am I entitled to? My daughter received Survivor until she graduated. So if you're receiving SSDI, it's 2014. So hopefully they evaluated you for what's called disabled widows benefits at that time. And if his benefit amount was higher, it's you get 71.5% of his full benefit amount as a disabled widow's benefit. Hopefully you check that out. So I would call Social Security and find out whether you're receiving, Social Security disability on your own record or whether they did switch you to disabled widows benefits. All right. Okay. My web address question is basically how do we know if a web address is legit? It has .gov and looks good. Yeah, just if you're looking for SSA.gov, just type in SSA.gov. So don't click any links. Just go straight SSA.gov. Yep. It tired for survivor benefits. I tried for survivor. That's how they found my overpayment, and now I'm not getting anything. I was getting SSI. Well, yeah. If you're receiving SSI, you have to file. Yeah, you have no choice, unfortunately. Yes, if you didn't, and they found out you were entitled to survivor benefits or divorce spouse benefits while you're receiving SSI, then you're going to have a big overpayment there because you're entitled to other benefits. Yeah, so that's the unfortunate part of SSI is because it's a welfare-based benefit. If you have any money out there, you have to file for that other money. So, all right. How does your Medicare partner make their money if they're 100% free? It's just like every other Medicare insurance agent in the country. They get paid directly from the companies. So, but Chapter is different than most in that their agents, the brokers that help you out, they're agnostic in the sense of it doesn't matter whether you sign up for insurance company A, B, C, D. Even if the company itself doesn't make any money on it, then the people that help you don't care. They still get paid the same from the company. But the company, if you signed up for a Medicare insurance plan, and that company, the health insurance company pays the company directly. So, and that's how every Medicare insurance agent in the country, nobody will charge you because they get paid directly from the company. But the trick is to make sure they're not steering you to a plan or something that particular individual makes more money on. That's the trick to watch out for. That's why I picked Chapter, is because that's not an issue whatsoever, because the people that help you don't get paid any different if they enroll you in plan, Medicare company A, B, C, D, E, F, or G. It doesn't matter. They're completely neutral. That's why I chose to work with them. All right, we are over an hour, so that's it for today. If I missed your question, I apologize. I will be back tomorrow and answer some more questions. So make sure you